Every child deserves to feel safe. But for too many kids, that's not the reality.
Every year, Wake County receives thousands of reports of suspected cases of child abuse and neglect. These kids are scared, they're vulnerable,
and they need a safe place to go.
A place where they can get professional help and begin to find healing.
That place is here, at the SAFEchild Advocacy Center.
When my daughter was 4 years old, she was sexually abused. She had nightmares. She was afraid of everything.
Kids often have to travel to multiple jurisdictions, look into the eyes of strangers, and describe the abuse to law enforcement, child protection, prosecutors, victim advocates, mental health, and medical experts. Their nightmare stalks them.
It's extremely difficult to get the child to open up and talk to a stranger about some of the most intimate things in their life. And to ask the child to do that with multiple strangers in a series of interviews is really just unspeakable.
As a mom of a little girl, it was horrifying to just watch her have to say what had happened and tell her story over and over, and just have to relive that again and again and again.
Thankfully, SAFEchild is now bringing together the pieces of the puzzle in one place, the Child Advocacy Center. When a child comes here, he or she can be interviewed in this cozy room, equipped with a hidden camera and microphone. It's a friendly, safe environment where a child can feel protected and comfortable.
Meanwhile, down the hall in this room, law enforcement, medical professionals, and social workers can watch the interview on this closed-circuit television without the child ever having to be aware of their presence or having to repeat their story. The recorded video is saved and can be used as evidence if the case goes to trial. Dr. Elizabeth Whitman is a pediatrician with WakeMed Health and Hospitals, a collaborating partner of the SAFEchild Advocacy Center.
I've worked in a lot of settings in hospitals and clinics and offices, and I think this setting is much less intimidating to children to come to the Advocacy Center. I think the sharing of information is very important for all of us to do our jobs better.
Kids who come to the Advocacy Center for help can also get things like a routine medical checkup, which they may never have had before, and referrals to pediatricians and critical mental health services.
6 months of mental health services for a child is like 10 years for an adult.
When all these professionals come together in one place to help the most vulnerable victims of abuse, those children can begin to rebuild their confidence and their lives.
Being brought in to the SAFEchild Center, by being brought in with law enforcement and knowing there are all those people there to protect them, I think it's an ideal situation for as difficult a process as they're obviously going to have to go through.
I'm just really glad that, this is a place kids can come and that they're nurtured and taken care of and their needs are met and that they can start the healing process.
The Child Advocacy Center, a place where kids can stop being victims
and get back on the road to just being a kid.